What does a complete blood count show for sickle cell? Imagine a simple blood test that can tell us a lot about how sickle cell disease is affecting someone's blood. That test is called a complete blood count, or CBC. It's a common and important tool doctors use to understand what's happening inside the blood. When it comes to sickle cell disease, a CBC reveals specific patterns that help diagnose and monitor the condition. In people with sickle cell disease, the CBC usually shows anemia, which means there are fewer healthy red blood cells and less hemoglobin. Hemoglobin is the protein in red blood cells that carries oxygen throughout the body. Because sickled cells have a shorter lifespan, often only about 10 to 20 days instead of the normal 120 days, the body struggles to keep up. This results in low hemoglobin levels, often below 11 grams per deciliter, indicating anemia. During sickle cell crises, hemoglobin levels can drop even further, leading to more severe symptoms. The red blood cell count in a CBC is also typically low because the sickled cells break down faster than normal cells. This ongoing destruction causes the anemia. The white blood cell count, which normally helps fight infections, is often elevated in sickle cell patients. This increase, called leukocytosis, reflects chronic inflammation and the body's response to ongoing tissue injury and hemolysis. Elevated white blood cells can also be linked to a higher risk of complications like stroke. Platelet counts tend to be higher than normal in many people with sickle cell disease. Platelets are small cell fragments that help with blood clotting. Increased platelets can sometimes contribute to blood clots and strokes. Additionally, platelet function may be abnormal, adding to the complexity of the disease. Sometimes, doctors also look at reticulocyte counts, which are not part of the standard CBC but are often checked separately. Reticulocytes are young red blood cells, and their numbers are usually high in sickle cell disease. This indicates that the bone marrow is working hard to produce more red blood cells to replace those lost to destruction. Overall, the CBC provides a snapshot of the blood's health in sickle cell disease. It shows the presence of anemia with low hemoglobin and red blood cell counts, along with increased white blood cells and platelets. These findings reflected the ongoing process of red blood cell destruction, inflammation, and the body's efforts to compensate. Monitoring these levels helps doctors assess disease severity, guide treatment decisions, and watch for potential complications. Remember, each person's experience with sickle cell disease can be different. Always consult healthcare professionals for personalized advice and management. The CBC is a vital part of understanding and caring for this complex condition, helping improve quality of life for those affected.